I'd like to take a few moments of your time and just talk about students with exceptionalities and the process that is required in order to provide these students services. First, it's important to define an exceptional child. A child who has an exceptionality, just a difference, in some area of functioning in which he or she is significantly different from an established norm. But recognize there is no universal definition of what it means to be different or normal, and on what basis are we defining these students. This is due to an amazing amount of biological and social differences within the human species. It's important to remember we are all very different, but we are looking for exceptionalities to be something outside of the norm. What are some of the areas of functioning that are affecting individuals with exceptionalities? We have learning diversity, developmental delay, learning disabled, or learning disability, or a learning difference. We have ADHD, attention deficit hyperactivity disorder, or we have GNT, giftedness. We can have social emotional diversity, ED, BD, ODD. We have emotionally disabled or emotionally different, behaviorally disabled or behaviorally different, ODD, which is oppositional defiant disorder or oppositional defiant difference. We have different social habits coming from different social contexts or maybe even different cultural contexts. We have communication diversity, people with speech impediments, students with language disorders or developmental differences, and students with hearing differences. We have physical diversity. We have students who are blind, students who are deaf. We have students who are other health impaired, which could be something as simple as a broken arm, a broken leg. I had a student with a hip replacement. We also have TBI, which is traumatic brain injury. Okay, the IEP process is underneath the IDEA law. It is our responsibility as teachers or as a school to find and evaluate students with learning differences. Under 504, it's the responsibility of the individual and the family to self-identify. It's just a small difference. Step one is pre-referral. There are generally events, okay? Generally speaking, there are events with the child in the classroom. This is usually in the regular education setting that makes the teacher think about or raises eyebrows. Individual interventions and screening may take place at this time. It's important to remember three things. One, we always raise eyebrows at any difference. Two, students may come to school with the awareness of a functioning difference. Or three, we have to write notes. We have to begin to collect data. Major side note, okay, the RTI, response to intervention, this is currently what people are doing to provide preventative measures to avoid student referrals to special education services that are unnecessary and keep all students in the classroom with an effective teacher. Okay, then students are referred. The intervention and screening of individuals, which will include parents, decide that it is appropriate to refer a student for eligibility and formal evaluation meeting. Teachers, administration, school service providers, and parents meet with documentation and data to determine what's going on with the data, and then do we need to evaluate this student. If it is decided that the student will not be evaluated, parents still have a right to due process. 3. Identification. The intervention and screening individuals, which includes the parents, decide that it is appropriate to refer a student for eligibility and formal evaluation review. Professionals decide which tests and areas will need to be evaluated. Note, this has to be done within 60 days, or the school and individuals may be determined to be OC, which is out of compliance. Eligibility. Within 60 days, IEP team of teachers, administration, service providers, and parents will meet to discuss the result of the formal evaluations. At this stage, if a student is determined to be eligible, an IEP will be created or an IEP meeting date will be set. IEP development. This is the beginning of creating the educational plan for that particular student. All members of the IEP team will decide upon a course of education that is appropriate in the FAPE, in the LRE, public education in the least restrictive environment. Students' accommodations will be determined, student services will be determined, student goals and objectives will be written. Implementation. Students will receive special education services within 30 days of the IEP development. 7. It is required that students receive annual reviews of their IEP. At those meetings, goals, objectives, services, and placement will always be evaluated. Data should be present for all aspects of that student's education. Traditionally, it's required by law that students have eligibility reviews every 3 years. So that's when they sit down and look at the tests again and decide whether or not the student continues to need special education services. And then we have placement. Students are placed at different levels meant to serve students with different needs. There are different models of special education. Inclusion keeps them in regular education. Support, meaning perhaps they might be provided with a service provider or a educational aid, or a paraprofessional tutor within the general education setting. You could have a resource or a pullout where they'll spend most of the time in the normal curriculum with the general education population, but may receive support in math or English. We have 4, which is a self-contained, which means they will be in their own room with a special education teacher throughout the day. And then finally 5 is a special school or residential treatment. We are shooting for inclusion here. We want to make sure that everybody is within the general education population if it is the LRE, the least restrictive environment. So that's just a kind of overview of the major steps in the IEP process.